Welcome to the girls. We're winding down the season, Janine. We're getting closer to the wedding.
The wedding, the wedding.
Janine's getting married.
I am. Actually, when this is airing, the last day that this will air, the first time, will be on the day I'm getting married.
Yeah.
July 14th,
Wonderful,
2023.
Wonderful, make it.
Wonderful, I'll make it. Anyway, Rosie's here with us. Say hi, Rose. She's on the clock today.
Yeah.
She's tired though, because it's later in the day.
Yeah, well, we've been
it's
really
okay.
busy. It's
We
hectic.
have.
We've been running here, there, and everywhere. The final fittings. It's the, practicing with the hairdos and the whole 9 yards and
Yes.
everything. So
It's going to be exciting. We'll show pictures down the road because everyone's been asking. But today our focus is on something that everyone's been asking us about, and that's
are you
women.
regular? Yeah.
Are you regular? Are you pooping? Who pooped? Who didn't poop? Why can't I poop? So today on the show, we are going to talk with Lehigh Valley Hospital, an expert on the field of medicine, and that is Dr. Jodi Lenko. So she'll be on with us to talk about some tips on keeping your gut healthy.
Yeah.
Yeah.
And I got your Christmas present for you already.
I heard, but
Yeah.
we'll talk about that a little later.
Yeah, we have a lot of things how to get rid of your constipation and
Good.
just good bowel habits. So what did you ask Facebook today?
I always like to ask my friends a little bit of a question of like if they have questions about the show, if they have questions about what we're wearing and that sort of thing. And I said, so what does one wear for a TV show on bowel movements? And the answers were funny. Air fresheners, Depends, brown, diapers, a toga outfit, something brown, commando. Like, it was funny. Hospital gown open in the back. A white suit, a bucket hat with Prada or Gucci sunglasses. I don't know what you'll wear, but you will be sitting on a stool. Get it? Depends, something brown. So it was funny. Crappy
It's
clothes,
funny.
a thong.
When I'm on the throne,
Throne.
I have hardly anything on because I feel more comfortable.
There you go, everyone.
So
TMI
I would
right there.
have showed up with nothing on.
There you go. Thank you for that. Thank you. What about you, Rose? Rosie doesn't have problems going to the bathroom, so she'll probably be bored. But when we come back, again, if you are a woman out there who has problems going to the bathroom or you want to just keep a healthy gut, we have a lot of information coming up.
Not just women, how about men?
Well, we talk about, I don't know one guy who can't go to the bathroom. So,
You never know.
fight me on that. Right, Rosie?
Rosie just picked her head up and said,
I know.
Yeah, I know.
She's over it. She's over it. So,
Well, all right, on that note,
drink your water and get a notebook and a notepad because you're going to be taking notes to go to the bathroom. Stay with us. You're watching The Girls on SSP TV. Welcome back. You're watching The Girls here on SSP TV and SSPTV.com. We're very excited to have our Vice Chair for the Department of Medicine for Lehigh Valley Hospital Hazleton. We have Jodi Lenko back with us, and it's nice to actually see you in person. I think the last time we actually spoke, we were still on Zoom.
Probably, yes.
You
It's
know.
been a little while, but happy to be back. Thank you.
thanks for joining us, taking some time out of your busy schedule, too.
As always, at any time.
We have a very important thing to talk about today, right? It's something that everybody does every day, hopefully,
We hope.
if
You
you're
should.
lucky. But if you're like us, we want to talk about the incredible poop.
Poop.
Everybody needs a poop.
Right.
So,
Healthy gut,
Every
healthy gut.
day you need to eliminate some of the foods that you've eaten throughout the day. And I think a lot of those things of today, with all the preservatives and everything, a lot of people are talking about being constipated. I mean, it's like,
Yeah, that's
what's
what
the
we were
constipated? They're
talking
blocked
about
up, and
that.
they don't have time, or they don't know what to do. So we want to put all those myths to rest about what's good, what isn't good, what you should do, what you shouldn't do.
Sure.
So
Yeah, there's a lot to talk about.
sorry that we're throwing this at you, but that's what we want to talk about.
That's okay. I'm happy to be as a resource, and hopefully I can answer as many questions as we can get through. But yeah, so it's an incredibly important topic, right?
It is.
It affects us every day.
Every day.
Hopefully. And some people normally it doesn't have to happen every day. So poop, stool, bowel movement, however you want to call it, it is a really important part of our overall health. So there's a lot of different things that go into having a healthy bowel movement regularly, and hopefully we'll get into some of those, conversations today. Yeah.
Well, do your bowel habits begin when you're a baby? Are you born with certain enzymes or something that help you to go better? Or tell us about
So
what
when you're
happens.
born, when you're an infant, you actually have very little bacteria inside, because everything inside is inside your womb, inside the mother's womb, and inside the uterus. So there's very few bacteria. So as you are nursing or breastfeeding or getting formula, slowly you're getting introduced other bacteria, either just from the environment. So there is a slow process that babies' guts get colonized. Basically, we talk about with healthy bacteria. We are full of good bacteria in our bowels, and that's a super important part of all of our healthy gut. So keeping those bacteria there is a good thing. We need to keep those healthy bacteria there, and there's actually a ton of information going on about where the healthy bacteria can actually be really good for your overall health. And if you don't have those healthy bacteria, it actually can have other issues with a lot of other chronic illnesses as well. So there's a lot of research going on with that right now, but the most important thing starts with a healthy diet, and that's the biggest piece.
When you say healthy diet, now you can eat fruits and vegetables, and sometimes does your body get used to it where you still can't go to the bathroom, or is that something where some people just don't go every day?
There's a wide variety, right? So we don't talk about necessarily a normal frequency of bowel movements. There's averages. So most people, on average, the average adult, especially in America, goes on average once per day. That's the average, but the norm is up to as frequently as 3 times a day. It could be normal.
Wow, I'd have a party on 3 times a day. I might have to call my friends and family for that one.
Yes, it can be quite momentous when it happens, but and then it can be as infrequent as up to 2 or 3 times a week. The most important thing I tell my patients is don't stress about it, as long as when you poop, there is a really important characteristic of the poop when you're going. So if you're going to the bathroom 2 or 3 times a week and you're not straining, you're not forcing, and the poop is soft and not watery, but soft and not hard like a pebble, that's still normal. So as long as you're not straining and as long as there's no other warning signs, that 2 or 3 times a week for you, if you feel good, that's great. Keep it at that.
What if you go every day and then you like some people say when they travel, and this is literally all from women who I've talked to, because it seems like a lot of women talk about this privately, so we get to talk about it publicly with you. So when they travel, they can't go to the bathroom, even if first it was like, oh, I thought it was because I flew. No, but I drove. Well, I tried to eat the same food, but I still couldn't go. So is there something that is making them not be able to go to the bathroom?
The majority is related to dehydration in that situation. Yeah. So, and when we travel, we don't know where the next bathroom is going to be. You don't want to be getting up and down in the airplane. Traveling by car, you say you want to get hydrated, but who wants to stop every 30 minutes when you have to go to the bathroom, when you have to urinate? Actually, with the airplane travel, that's interesting because there is actually a physiologic reason, meaning a physical reason. So the pressure changes actually suck the water out of our bowels. So when we do fly, we actually get more constipated just because of the pressure differential when we go up high in the air. So there actually is a real reason for that to happen when you're flying.
So drink more water.
Correct, 100%. Try to drink as much water as you can when you're flying. Anytime the flight attendant is coming by, ask for a glass of water. Really try to drink as much water as you can on a flight. And then the other piece of it is that we're just out of our normal routine. So we're often, even though we say we're eating the same, we're probably not. We're probably eating a little bit heavier foods, a little bit saltier foods, a little bit maybe more cheese, more pizza, more other things that are not as good for our stomachs.
So carbohydrates really constipate you?
It's a balance, right? So it's all about finding a balance and making sure you have a good amount of dietary fiber. So we talk about dietary fiber all the time, and that's with our fruits and vegetables as well as our whole grains. When we process our whole grains, the ultra-processed foods, it gets rid of some of that dietary fiber. And that dietary fiber is what keeps the bulk into our stool. So that's very helpful in preventing constipation and also preventing diarrhea. So it's a really good thing to have in your system. The other thing is that, you talked about how getting used to fiber. If you have a pretty not great diet, and then all of a sudden you go and decide that you want to go crazy with either a supplement over the counter, or you decide you're just going to eat only raw fruits and vegetables, your system will not be happy. So sometimes you have to get gradually used to those things and incorporate them slowly into your body, or else you will be gassy and you won't feel good, and you'll think it's because of the fruits and vegetables. It's just because you're not used to the fruits and vegetables.
So some of the ways you could put extra fiber is with some of the over-the-counter things. And as you said, you have to introduce them gradually.
Correct, yeah. Otherwise,
So-
they can cause some bloating and discomfort.
What is the way you would introduce that gradually? Should you use a teaspoon, 2 teaspoons, 3 teaspoons? You start that gradually every day?
Yeah, so generally I tell people if they're very sensitive, so some people know that their bodies are sensitive to supplements and things, I tell you every other day. And make sure you're drinking lots of water, because the way it works is that your colon and your intestines are a tube. The fiber's in there and it's sucking water out of your body and putting it inside the tube, inside the colon, to allow more water within the poop. And that's how
So drink more water. We don't drink enough water.
most of us do not.
We don't drink enough water.
Yes.
I don't drink enough. I know I don't drink enough water.
So starting good bowel habits for your children also. What would you tell mothers with babies and toddlers and whatever else as well? Because I know a lot of times I would see posted on Facebook, my child is, constipated. Should I use a suppository?
Yeah.
Should I use an enema? What do you say about that?
So it depends. I mean, always when you're getting to that area, you always want to consult your physician, your family medicine physician, your pediatrician when it comes to before you would ever give a medication or a suppository or enema to a child. Most time, there's a couple reasons why kids get constipated. A lot has to do with they don't want to take the time, so they hold it in, and that causes problems too. And that goes for adults too. We talked about our busy lifestyle, me running around in the office all the time. When you feel the urge to have a bowel movement, it is highly recommended that you go and try. Try not to delay that, because that's going to possibly create some constipation as well.
We're talking about the constipation part about it. How about the flip side of that? How about people who go like all the time? What is that caused by?
Yeah, that's an equal, that's an equally, in my world, that's an equal area of a problem. The other thing I don't think I mentioned was that a lot of these things, some of these problems, especially as you become older and start taking medications, are caused by medications. So we have a lot of situations where we're taking certain medications and you have to take them, but they result in constipation. Specifically, pain medications are notorious for causing constipations. There's a lot of diabetic medications that are out there that cause diarrhea. So a lot of them, we call it, is self-inflicted, meaning we know we're causing the problem. So we really do our best to try to figure out that problem and tackle it. There's a lot of different reasons for diarrhea as well, and some of it could be related to diet, some of it could be related to just inflammation, colitis. You've heard about some of these other terms. Very important to keep these conversations going with your doctor, because this is where a colonoscopy could really be insightful in figuring out, is it IBS, irritable bowel syndrome, which is more stress and anxiety related, or is it more the diarrhea is coming from a more severe condition like colitis or Crohn's disease, which is a completely different beast and very important to pick up.
All right, well, we're going to take a quick break. You're watching The Girls here on SSPT. We're with Dr. Jodi Lenko. She's the Vice Chair for the Department of Medicine for Lehigh Valley Hospital. And we are talking about healthy guts, right? So should you be using suppositories? Is it healthy to be using laxatives? What if you see, blood in your stool? We're going to talk about those issues when we come right back. So stay with us right here on SSP TV. Welcome back, everyone, to The Girls here on SSP TV. We are talking about a healthy gut. So we should be pooping once a day, at least.
At least. You know how good you feel after that?
Very good.
Why is that? It's like you go to the bathroom, all of a sudden you feel,
Because there's no pressure
you just
there,
feel
right?
like you don't have a headache, you don't feel like moody, and you don't feel bloated, and
All of the above, and because you feel better, your mood gets better. You feel good. Yeah, especially after a full evacuation and a full bowel movement. Yeah, you feel good. It's just, yeah.
So with Dr. Lenko, and we are continuing our conversation. Before the break, we talked about laxatives and some of these suppositories. Should we be using these? Or, how many days, if you go 4 or 5 days without going to the bathroom, should you call your doctor? Should you try something over the counter?
Yeah, in general, once you've gotten to the 4 to 5 day mark, it's generally a good idea, depending on your age and your health conditions, because a lot of these things are going to be dependent on how serious it is, and especially an older individual, we're going to be a little bit more careful with certain medications. Some of the laxatives over the counter can be really dangerous if you take them too often or too frequently. They can cause dehydration and electrolyte issues, so you do not want to be taking these regularly without consulting with your doctor. But yeah, a 4 to 5 day mark is a good time to start trying some of the over-the-counter supplements. They're over-the-counter for a reason, meaning that you can safely use them on your own. But if you get to the point that it's still not working, especially after 6, 7, 8 days, that's when I usually get the phone call.
So I hear a lot of people will say, oh, I need to have my cup of coffee and my cigarette to go to the bathroom in the morning. Does it really help?
Yes, it does. So there are chemical reasons why coffee is a natural stimulant, and it stimulates the bowels to move. Same thing with a cigarette as well. Some of the nicotine as well stimulates the bowels to move. Just kind of like almost like when you're nervous, when you feel like you have the nervous sensation in your stomach. There's different receptors in your stomach, and that's the way some of the prescription medications that you might encounter are also work, as they work on these receptors to just kind of help stimulate the bowels to move, because sometimes that's a problem for people.
So the caffeine, not the decaf, or is it the warm water even?
No, it's usually the caffeine.
It's
it's
the
usually,
caffeine.
yeah,
And
and
forget the cigarette, right?
No, we're not gonna go there. Yeah, we don't like that. Yeah.
So I've heard also some of the big fad diets and things that are out for you to, really get a healthy skin glow and whatever, and they're recommending different kinds of cleanses. So what's with the cleanses? What are these like?
Yeah, I'm not a fan. First of all, there's no proven benefit that they're going to benefit your skin. The best thing for your skin is to be eating the things you should be eating to avoid the necessity for a cleanse, right? So you want to be eating the fresh fruits and vegetables regularly. You want to be exercising regularly, getting your hydration, your water intake up. All those things are way more important than needing a cleanse. There are really good things in our bodies. We talked about the bacteria before. Doing a cleanse and things like that, especially on a too frequent basis, will get rid of all that good bacteria, and it's a really it's not good to get rid of all that that good bacteria because you need it. That's really important for your body.
Speaking about the good bacteria, do the probiotics put them back in? And what's the difference between a probiotic and a prebiotic?
Yeah.
So that's a good question. So the probiotics are basically bacteria, right? So it's the equivalent of taking some active bacteria and ingesting them. They do help certain situations, especially when we have patients on antibiotics and we're really trying to repopulate your gut with good bacteria. They do help. It is really I describe it to people as a drop in the bucket in terms of the amount of bacteria that you're getting with a capsule of a probiotic versus the amount of bacteria that's in your gut. It's literally like the equivalent of taking a drop and putting it on this entire table of bacteria. So it's a very small amount. There have been some studies that show that it might have some benefit, but it's probably small. The prebiotic is more of providing a good environment for healthy bacteria to grow. So that's providing, the prebiotic, when I think of it, is providing the fruits and vegetables and multi-grains and legumes and all that good stuff so that the bacteria have a nice place and a happy place to grow inside your gut. So that's how I think of it.
So without the probiotic wouldn't work anyhow.
Correct.
You're not going to get nothing there to grow, so it's like having lousy soil.
Why does it sometimes make you sick?
The probiotics?
So I can't take them. I've tried, and it just has made me so nauseous.
Most times it's because most of these things we're talking about are in your gut, right? But you have to pass through your stomach first. So there's a very different environment in your stomach, so it has to get to your gut in order to work. So oftentimes some of these things are kind of harsh to take on your stomach, and they don't taste good or they don't make you feel good on the stomach part until they get to the gut.
So throw all this stuff away and just eat right and drink water. And does movement have a lot to do with it too? You need to move.
Yes, you cannot be a couch
sit
potato.
all day.
Yes, absolutely. So people that exercise definitely have more regular bowel movements. That's been proven. And it doesn't have to be P90X. It could be something as something as walking, exactly. But just getting up and moving, even post-operatively. So even after a surgery, the most important thing they want people to do is get up and move. That helps get everything moving around as well.
So is yogurt as good as it claims to be? Everybody's touting the yogurt. How much? Being that you said it, it's just a little drop in the bucket.
Yeah, yogurt
So-
is a good source of nutrition. It's a good source of protein. The thing you have to be careful with yogurt is there's a lot of yogurts that have a ton of added sugar, so that oftentimes negates, the benefits that you're getting from the yogurt. But yogurt is a great source of active bacteria as well. So it is a good place to start. It's a good place for some calcium in our diet as well, in addition to the protein. So it's good. It's not going to be I think
cure-all.
Yeah, there's a lot of different pieces to it.
And how about Greek yogurt versus regular yogurt?
Greek yogurt tends to have more protein. So Greek yogurt, the way it's cultured, and I tell people to try to do the plain if they can. If you need to add some pieces of fruit, you're getting some extra fiber in with your extra fruit, as opposed to getting the strawberry pre-flavored that tends to have more added sugar. Or to me, sometimes worse is the artificial sweeteners.
Yeah. So no artificial sweeteners.
I'm not a fan of artificial sweeteners in general. I
Like
think it's
the ones that are like plant-based.
Yeah, the stevia as a plant-based is probably not quite as well studied as the other ones.
You're better off just using a scoop of sugar
A little bit, yeah. If you need to say a tiny bit,
or creamer, right?
Yeah, if you need that, or if you can add it with a natural fruit, get the natural, the natural sugars in the fruit are way healthier than the table sugar.
So does the protein, if you have protein, could that bind you as well, or is it?
Yeah,
It can?
Protein without other things in your
Right.
diet
So if
can
you're
bind
eating
you.
the fruits and vegetables,
Yeah.
you're drinking that water.
Correct. Yeah. So if you just drink a protein shake and don't drink any additional water or don't change your diet, you're going to get protein in your diet, but you're probably going to develop some constipation as well.
How important is chewing in this digestive process? Because I see a lot of kids eat so fast. And I know growing up, we're always in a hurry, as we said. But if you're eating fast, is that part of the constipation as well?
Not generally, because the stomach is an amazing environment to digest most food. So it can take a big glob of food.
So they can take dumping. Okay.
Yeah. So the chewing process starts. There's enzymes in your saliva that start to break down.
You hear some like all these things that people will do anything to go to the bathroom. I get it. And is it true when you first wake up that you should just have a big glass of water?
Yes, well, that's true for overall health purposes.
Okay.
Yes, that is because
We're overwhelmed with different things, and you're trying all these things,
Yeah.
and it can be overwhelming.
The
And if
answer
you-
is water is almost
Water.
never a bad thing,
Right.
but I tell
Water
people
first.
the same thing. Drink when you're thirsty. There's no set amount of water that is absolutely necessary, but most people are not drinking enough water, especially my older patients are not drinking enough water because they are either incontinent and they don't want to have to go to the bathroom. So they probably are not, but drink when you're thirsty, and we're probably, and then probably add a glass or two.
There's an aid that I heard about. It's called the Squatty Potty.
Yeah.
Squatty potty. I know
Everybody's
friends who
got
live by
one
it.
for Christmas.
Oh, geez.
So the squatty potty it's more of a technique, right? So all the squatty potty does is it's actually changing the angle of your pelvis and your rectum. So what it does is if you think about raising your knees up to the level so that your angle, instead of sitting like this on the potty with my butt down there, you're sitting like this so that it changes the angle. And actually what you're supposed to do is actually sit forward a little bit. And what that does is, if this is my rectum at the bottom, it's kind of straightening that out and pulling it down straight as opposed to being curved, because your rectum and your colon are very, very curved. And it helps relax a bunch of muscles that are really important to helping you go. So there's the squatty potty version, but if you can also get it by doing any other way to get that angle, including squatting, which is what we all, what cavemen and what our ancestors did in the woods. That's why our bodies are designed that way, is because that's how we were designed to go to the bathroom, not sitting on a porcelain toilet.
Right.
To get those little
We have
dirty
so much information. I know people are going to come up to us and thank us for the show, because my girlfriend said, if you do a show on this, we're going to love you. And when I called Lisa Marie up, I said, you're not going to believe this, but can we do a show on going to the bathroom for women? Because it's always something that we talk about once a week at least.
Every day. Did you
Yeah.
go? Did you go? So
Yeah,
we're
you're
going to
doing
dig
the-
out our Dora the Explorer little chairs that we had for the kids to stand and brush their teeth. We still have them, and we're going to get those out, and everybody is going to have a good day.
And
right?
we appreciate you coming on. It's a wealth of information always from Lehigh
I'm
Valley.
happy to be here
Thank
and
you.
happy to come back in the future. So I'm glad to help.
Very good, very good.
Thanks again.
You're welcome.
Well, I'm going to go drink some more water.
All right, I'm going to go poop. See you next time on The Girls.